Welcome to our introduction on understanding the basics of Marfan syndrome. Marfan syndrome is a genetic disorder that primarily affects the body's connective tissue, which provides strength and support to various structures throughout the body. This syndrome impacts many parts of the body, including the heart, blood vessels, eyes, bones, and joints. Typically, people with Marfan syndrome have a tall and slender build, with long limbs, fingers, and toes. Named after Antoine Marfan, the French pediatrician who first described the condition in 1896, it is estimated to affect about 1 in 5,000 people worldwide. Marfan syndrome is a chronic condition that requires lifelong management. However, with proper medical care and support, individuals with this syndrome can live full and productive lives. Early diagnosis and treatment are crucial in preventing serious complications. Now, let's delve into the types of Marfan syndrome. Marfan syndrome is typically categorized into different types based on the specific gene mutation involved and the clinical presentation. The most common type is classic Marfan syndrome, caused by mutations in the FBN1 gene. This gene provides instructions for making a protein called fibrillin-1, essential for the formation of connective tissue. Another type is neonatal Marfan syndrome, a more severe form that presents in early infancy. Infants with this type often have heart defects, breathing difficulties, and feeding problems. Neonatal Marfan syndrome is usually associated with mutations in the TGFBR2 gene. Finally, let's uncover the genetics behind Marfan syndrome. Marfan syndrome is primarily caused by mutations in the FBN1 gene, located on chromosome 15. This gene provides instructions for making fibrillin-1, a crucial protein for the formation of connective tissue. The mutations are typically inherited in an autosomal dominant pattern, meaning that a child of an affected parent has a 50% chance of inheriting the mutated gene. However, in about 25% of cases, Marfan syndrome occurs in individuals with no family history of the condition. These cases are referred to as de novo mutations, meaning the mutation arises spontaneously. Section 4. Navigating the risks factors influencing Marfan syndrome. While Marfan syndrome is a genetic disorder, several factors can influence its severity and progression. One significant factor is the type and location of the FBN1 gene mutation. Certain mutations are associated with more severe symptoms and a higher risk of complications. Additionally, environmental factors can also play a role. Smoking, high blood pressure, and intense physical activity can put extra stress on the cardiovascular system. Managing these modifiable risk factors through lifestyle changes and medical interventions is crucial for improving outcomes. Regular medical checkups, including echocardiograms and eye exams, are essential for monitoring the condition. Section 5. Prevention and precautions taking charge of your health. Given that Marfan syndrome is a genetic disorder, preventing its occurrence altogether is not currently possible. However, individuals with a family history of the condition can opt for genetic testing and counseling to assess their risk and make informed reproductive decisions. While a cure for Marfan syndrome remains elusive, focusing on managing symptoms and preventing complications is paramount. Regular monitoring by a healthcare professional specializing in connective tissue disorders is essential. Medications like beta blockers can help lower blood pressure and reduce the strain on the aorta. Maintaining a healthy lifestyle is also crucial, including regular exercise and a balanced diet. Section 6. Conclusion: empowering ourselves with knowledge about Marfan syndrome. Marfan syndrome, a complex genetic disorder, presents unique challenges for individuals and families. We've explored its genetic basis, the different types, and the risk factors that can influence its progression. While preventing Marfan syndrome remains outside our current capabilities, managing its symptoms and mitigating complications are achievable goals. Early diagnosis through genetic testing, regular medical checkups, and proactive management of cardiovascular health are paramount. By arming ourselves with knowledge and seeking appropriate medical care, we can empower individuals with Marfan syndrome to lead fulfilling lives. Continuous research and advancements in treatment options offer hope for a future where the impact of this condition is minimized.